Hi, beautiful.
Forgot where I got that from. I don't know.
Did you fix it so there's no waiting room, Amy?
No, I am.
Oh,
I'm trying to make you the host, but I'm letting people in.
okay, great.
I
They're
can't
really
remember.
coming on. They're ready to go.
Mm-hmm. I should have some like waiting room music playing.
Mhm. I'll
Where
sing.
is it?
It was, I don't know what you did before. What? Oh, it was going to participants,
Oh, in
right?
the chat. No, I know where.
It wasn't going to my name and then my name and the participants, and then you put, that's what I did to make Carrie a host one time.
Do you understand what she means?
Yes.
Okay.
But no. But where's the participant list?
On the bottom. Next,
Bottom.
next to the chat.
Okay.
Bottom left.
I got it.
Hi, Marilyn. Hi, Gail.
Hi. Hi.
Hi.
Irma.
Okay, so got the, okay, I'm looking at the waiting room. Okay. So how are we going to fit all these people on a screen? It's going to be a lot of little tiny squares.
The screen will make it so that there's multiple pages.
Oh, yeah.
It'll do it itself.
Okay.
I don't know how to change that back.
Oh my God. Oops.
Hi, Sonia. Hi, Marcia. Hi, Ginger. Been a long time.
How are you?
Hi, Carla. Let's see everybody's faces if you can. No matter how you look or whatever, we just want to see you. Because
I'm sending you a big hug and a kiss because I miss you.
Hello, Carrie.
Hey, Carla.
Oh my God, I can't. Where I gotta try to find everybody. Hold on. Hello, Irma.
Hello.
How do I get everybody on here? Where the hell?
Oh, you went back to host, Amy?
Just for a second.
Oh, sure.
Why can't I see everybody?
Hi, Amy.
I see everybody
Wow.
in one
Go to,
screen.
go to gallery view instead of speaker.
Well, I'm on my
Top
phone,
right.
so I'm trying to find it. Where
Oh,
is it?
I could never do that on my phone either.
Yeah,
I can
but
do it on my iPad. I can't do it on my phone.
I did it before. How rude. Oh, there we are. I got it.
You can see everybody?
I see. Well, I don't see Janine. I see Gail. Hi, Amy.
Hi, Carla.
Marilyn.
How do you get
Hello.
to see everybody?
Ginger. Hi, Liz.
Hi, Annette. Is that what that other thing was, the immersive thing? Where you
No,
could
you
see
just-
everybody on one wall?
You just swipe to the right.
Hi,
Oh, there it is.
Nico.
Swipe to the,
I knew I was able to. So Charlie's not on yet, huh?
He called earlier and left me a voicemail and said he would be.
He told me he was going to call you.
hi, Bill.
Hey.
I was in a meeting at Lynn's facility.
Oh,
I have a list that shows who's a microphone
This-
on and off. There's 10 of them that don't have their mics on.
See, I want to rename myself here. Second, I want to show you.
Gail, I don't think I've met you. I'm Melody. I'm in California.
Hi, Melody.
Hi.
We have people from a lot of different states here.
Yeah, and Marilyn. Hello, Marilyn. And
Hello.
the people I have not met before, and welcome.
Hello,
And
Melody.
Ginger and Jenny, and hi.
Hello.
And Annette and Bill. Miko, hello.
Hi, everybody. This is Darlene. I'm driving, so
Darlene's in Florida.
sorry, Darlene from Orlando, Florida, and I'm driving, so no video for me.
Okay, be careful.
Oh, I will. I'm happy to be with you guys.
Thank you.
Thank you. The most exciting part is that we have men here that I don't recognize. That is, there's a second one. Oh my God, this is like incredible.
Here's Kathy and Lori and Natalie is here. We're up to 25.
8 more minutes.
Mhm.
And Mary's coming.
Maitly, Irma, where are you?
Who's
Kevin,
talking?
hi.
Suzanne is talking. I'm sorry.
Oh, hi, Suzanne.
Wave or something.
Oh, here. I didn't put my video on. Sorry about that.
Oh, okay.
I'm telling everyone else to put their video on.
Mm.
do we know about how long this meeting's going to last?
1 hour.
Okay.
We
Thank you.
we've budgeted an hour. I think if it goes 50 minutes, we're not gonna, hang on.
Sounds good.
Jill, if you,
We'll find
Just
something to
you.
chat about if it goes that long. I know this group.
Jill, if you
You're all
can
good.
hear me, you should be able to log out and use the link and log right back in and get your video back.
Hi, everybody. This is
Where
Miko.
is- I Mary's here. I don't see you though.
Because when there's 2 screens full of people.
Yeah.
I would suggest to everybody to go in and right now while you have a moment, on the far right of your chat, there's 3 little boxes, and tell it to save your chat. So when you're done, you have everything that was in the chat box.
Yeah, I think Amy's going to be talking about all that, I think.
Okay, repeat that again, what we need to do.
Excuse me, Amy's going to be discussing things like that in the beginning.
Okay.
Just tell whenever you're ready, Amy. You ready to start? I'm going to mute everybody, okay?
8:01. I was just giving people some time.
And then you unmute yourself, Amy.
There we go. All right, it's 8:01. This is the early group. Everyone logged in nice and early. I just wanted to welcome everyone and thank you for taking your time to come tonight. Everyone here has had someone in long-term care, and you've committed your time and your energy to ensure that resident rights are never, ever violated or paused again in the future. We're here tonight to discuss the federal legislation, which is currently called HR 3733, the Essential Caregivers Act. Tonight was created, as you saw in the email. The primary purpose is to share, support, and energize those efforts towards that legislation. What we said in that initial email was it's not really meant to be sort of a collaborating group, though collaborations may come out of this group. It's more of a way to say what's going on across the country, and perhaps when we need to, bring people in, like we did for the congressional hearing where people wrote in last minute, which Liz will touch on later. For those that don't know about that, we needed to sort of get people together to do things like that. And then the housekeeping bit that Carrie started for me is everyone's now muted. We ask you guys to use the chat, which I will monitor. You can put in questions, you can put in links, you can put in helpful information, whatever you want. And like Carrie said, the dots to the right of the little smiley face will allow you to save it later, and it'll go into your downloads if you want to save any of the information in the chat. We asked ahead of time if anybody wanted to speak to let us know so that we can allot the time. Carla asked how long this is. We'd like to keep it to an hour. We appreciate everybody's time and the time zone differences across the country. We have 8 or 9 people who will be speaking, and we'll allow for question and answer at the end and discussion on how we see this moving forward, what people think of this kind of sharing of information to try to energize, efforts into the next legislative session. So Liz will be moderating, and she has some notes to go over before we get to the speaker. I guess we had the agenda. Did that get sent out? So where we are now, Liz?
Thank you, Amy, and thank you, Irma, for administrating tonight. I've got number 2 on the agenda. It's really interesting for me to be with a group where I don't know everybody. I know some, but I don't know even, I think, the majority of the people tonight, and that's an interesting place to be. We sent out 125 invites for this forum. And we did not require an RSVP unless you wanted to speak. And so I'm here to talk about who's here and who's not here. And I that's a funny way to start, but there are people who wanted to come tonight and we asked them to wait. But the people who did RSVP, I want to give a shout out to that wanted to be here tonight. And I'm sorry they're not, is Sam Kuchik, who out of Virginia, who runs the Dignity for the Aged. I was listening to one of her radio programs today. If you haven't listened to her, it's the latest program is just really very touching. I listened to the first one, was a little rough around the edges, but what I listened to today was great. The other person who's not here, who RSVP'd, who wanted to be here, was Mary Nichols. and she's the face of Caregivers for Compromise in Texas, and many of you know her. And the other person is a person most people don't know, but she's a daughter of a resident. She's an RN, she's a nurse educator out of Connecticut. And these people responded only to say that they're very sorry they couldn't be here tonight. Who's not here, who wanted to be here, is an interesting group. I think primarily we did not want people here today who were legislators, who were providers, who were other government funded agencies. There's no ombudsman with us tonight. And that's not to say that these people are not friends of 3733. We just wanted to test the waters with a group that shared the way we are sharing. And there was one group, they are the coordinators or chair people, I want to say, from Moving Forward that I'll talk about in a minute, who asked if we wanted their services to just listen to help us to maybe do this. You know, do you want feedback on how this goes tonight? And I asked them to wait, and I would be in touch with them tomorrow. But again, I'll talk about Moving Forward later on. I just want to underscore what tonight is, and I'm going to read. Tonight's forum is for family and friends of children, adults, and elders who live in long-term care. And the purpose of tonight is to share, to encourage, and to energize, to keep our momentum going. At the close of the hour, I suspect that we may have more questions than we have answers, and I see that as a real positive. With that, I'll stop. I will come back later with one of a 5-minute, but that was just a little bit of an addition to the housekeeping that Amy got us started with. So I'll mute, and I don't know I forget who our first speaker is, but oh, it's Irma. Thank you, Irma.
Thank you, Liz. Thank you, Amy. Good evening, everyone. So glad to see the great turnout tonight. When I was locked out of my mother's facility in March 2020, my voice as her advocate was silenced for the next 11 months until she died of dehydration and neglect because I couldn't assist her. I was reduced from being the most important person in her world to a nobody in the eyes of the facility. When staff wheeled her out for a socially distanced outdoor visit one day, I heard my mom say, "She can't do anything for me." Despite her Alzheimer's disease, she was a smart lady to the end. Notice that I put her name next to mine in my screen. And if anyone else wants to do the same for your loved one, you could. I want to thank those of you here tonight and all the others across the states who answered the call to join a health legislative assistant meeting to tell your stories and ask for the health assistant to recommend a bill be co-sponsored by the representative. That's what I did to get my own representative to co-sponsor, and that's what we're doing across the states. I'm very grateful to the health assistants who had these meetings for us, and for especially the ones who asked the representative to co-sponsor the bill. I've had meetings with 35 out of 50 states since May of this year, and about 120 plus meetings with 35 out of 50, with 35, excuse me, I've had about 120 plus meetings resulting in 45 new co-sponsors. People like Kathy Carlton also stepped up to reach out to the offices of their state's federal representatives and got co-sponsors. Mary Daniel founded Caregivers for Compromise, which has over 14,000 members covering all 50 states. That's a lot of voices speaking out, saying the isolation was wrong because look what happened to our loved ones because of it, and we must do better. A huge thanks should go out to the family advocates who got this bill put on the table. I thank Liz and Amy for supporting me in this project and helping me to get started. They do so much for family advocacy despite also being active caregivers. We all have a lot on our plates. The next legislative session is beginning in January, and we're keeping the bill on the table by continuing to educate the lawmakers and make them remember who they were fighting for, us and our loved ones, until HR 3733 becomes a law and no one will have to fear their loved one being totally isolated again in a public health emergency. Please continue to attend these HR 3733 forum meetings. Spread the word to others you know to join us at future health assistant meetings. Call and email your representatives' offices, and together we will brainstorm what we can do to make sure this bill passes. Thank you.
Thank you, Irma. Thank you. The next person we have speaking is Margaret Meiser from Florida. If you can unmute yourself.
Margaret Melzer, yes.
Got it. Okay. Can you all hear me now? Okay, great. Well, thank you, Liz and Amy and all the other people who put this awesome forum together. And I want to thank Representative Claudia Tenney for mentioning the names of all the people in the book that went to the federal legislators, for mentioning our names and our loved ones' names on the House floor. And my mom was also in isolation when the COVID broke out in 2020. And I just want to mention briefly that the proposed new law should allow caregivers and loved ones to visit their loved ones in facilities in their rooms and not just in the lobby of the facility. When the emergency orders were passed by Governor DeSantis, who listened very closely to Mary Shannon Daniel, who is one of the fiercest advocates I've ever known. We were not allowed, when we were first allowed to see my mom, to visit her in her room, where we could help her with activities of daily living and grooming. That I had to do that in the lobby. And I think that was very humiliating for her and for me too. And during the COVID and before the Florida Caregivers Law was passed, we were allowed to visit our beloved mother only in the lobby and then later on in her room. But then visiting days and hours were restricted. So I have not read the proposed bill, but it is very important to have room visits, allow hugs with all the necessary protective equipment, and allow daily visits at varying times within reason. And I just want to report too that in October of last year, my mother, after being in lockdown all those months since March, she had to go into the hospital in Gainesville to have surgery. And she was very upset. And she had to be on IVs for long-term care IVs for infection even after the surgery. And then she was sent after 1 week at the hospital to the nursing home here in Florida where we live. And she did not want to be moved after 6 weeks, but she went back to her assisted living facility and died January 3rd of last year. So I know her being in isolation had to contribute a lot to her failure to thrive. And she was praying that the Lord would take her. And I was not with her when she passed away, so that will always be a deep wound in my heart. And I just want to thank everybody again for being here. And I hope the representatives will go ahead and pass this law. It's way too long, I think, that this has been going on, that we don't have a law at the federal level. Thank you very much.
Thank you, Margaret.
Thank you, Margaret. I'm so sorry for your loss, as there are others as well. And thanks for continuing to speak out even after. Next, we have Vivian Zayas. I hope I said that right, from New York. If you would like to unmute.
Hi.
Hi,
Can you hear me?
Vivian.
I'm hearing an echo, so I just want to make sure you
Yes.
hear me.
Yes, we can hear you.
Hi, everyone. I'm so honored to be with you guys. I wasn't sure. I've had a really busy day, so I'm a little frazzled, so please forgive me. Well, first of all, I'm just honored again that we're still fighting for the Essential Caregiver Act. We're here downstate. We're currently in Long Island, and in the city, we have members that are predominantly in this area. My mother, who was receiving some care at a Long Island nursing home just a few months before the pandemic, was supposed to leave and then got shut in, and she was dead 3 weeks later. Since then, we've been pushing and honored to work alongside Claudia Tenney when she gave us a call, and we decided to help her push this effort forward. Unfortunately, I was looking at the New York co-sponsors, and there's so many of them who have not sponsored. A lot of them within our area. We have done our part by reaching out to them, and unfortunately, even one of our directors accidentally met, because he did not give us an audience. We met with Congresswoman Espaillat, and she asked him, if he would support the bill, and he said he would never. So it was really curious to us that he didn't even consider it, didn't even, patronize us with trying to say, look, I'll look it over. Even our meetings with AOC were not fruitful. So we're actually just looking forward to starting 2023. And after this election, when we know who's in office, trying to tackle this topic again. And we're hoping that we get new people that are passionate and caring and dedicated to the issues with our seniors, and especially what happened previously. So I'm looking forward to hearing, what.
Oh, sorry. That was my fault. Sorry.
Vivian, you weren't finished, were you? No, wait, you're still muted. Can you unmute? Sorry. Can you unmute her, Irma?
I think she was just about finished. I'm so sorry. So the next person, please.
Okay. Next we have Bill Lamb from North Carolina. Hi, Bill.
Hi, how are you? And
Good.
thanks as well for this opportunity to speak to you, and thanks to Irma for all the work she's done. It's been unbelievable. So I'm in North Carolina, and I'm involved as a board member of an advocacy organization, Friends of Residents in Long-Term Care. And we've been around since '87 and committed to improving the quality of care and lives of people in long-term care, assisted living facilities, and nursing homes. And when the pandemic hit and the lockdown, we became immediately aware of the negative effects that were occurring on residents because they weren't allowed family members. Family members are an integral part of the care delivery system. And without that, it was like it's a leg on the stool, and the system collapsed. You've heard stories tonight. I can't tell you how much I've heard related to the negative effects. We focused a lot of our attention on trying to get some laws passed here in North Carolina, and we were successful in getting 2 laws passed. But both of them lack essential elements to this. We do have in state legislation some recognition that caregivers do have a right to visitation, but everything gets trumped by federal guidelines and federal regulations. So the need to have a national standard that allows for access to caregivers and a recognition of the necessary component that family members provide in the delivery of not just care, but assuring the safety of the residents and facilities is something that we're just as committed to. And what we're continuing to do is to not only maintain a push with our local elected officials, it is with our federal representatives and senators. And so we're looking at this election keenly. And as soon as the results are finished, we will begin to start contacting those offices to make sure that they understand what this issue is and whatever form legislation is initiated in 2023, that they can get behind it, because we need to have a national standard. This isn't something that can be handled state by state by state. Thank you.
Thanks, Bill. That is true that there are some states that have passed their essential support laws, but it does need to be federal. So thank you for your comments. And Vivian, I'm going to ask you to unmute. Can you unmute?
There I am.
There you go. If you'd like to finish, we'd like to, it's very interesting what you were saying about your advocacy, trying to get your legislators. That was interesting. They said he wouldn't even.
Yeah, one of our directors is a police officer, and she was at I think it was a rally or some kind of march, and just so happened Mr. Espaillat was there, and she approached him, and it was very impromptu, so I don't think he expected it, and she asked him for his support, and he said that will never pass. A Republican put it forward, was his direct quote, and I was, I felt bad because I'm thinking, like, our parents were Democrats, and I really don't care about any of that stuff, but apparently, because she's a Republican and he put it forward, he didn't really care that it's been supported by Democrats as well. So we have a long list of people, like even my mother's congresswoman, Nidia Velazquez, she won't even meet with us. So unfortunately, that's not going to deter us from keeping our efforts on her, especially once we know the elections pass. But it's really this concerning that people, even AOC, whom we've met twice, and we actually saw her in DC. We tracked her down physically, and we actually ran towards her when we saw her and her groups walking by, and she said, "Send me an email to my staff." We did that again, and she didn't respond. So we did have one meeting with her, but she apparently didn't support, which, I tried to appeal to her as a Latina. My mother was Hispanic, and, we're from the city. My mother has been a long-term Democrat and lived in New York City since she was really young. So, we're going to continue our efforts. We've tried to meet with so many people. One of our directors sent a letter also to Nancy Pelosi, trying to get, their attention from everyone. So we knew that the election would actually kind of cool the waters for a little bit. We applaud Irma for her efforts because she's been amazing. So we know that I was just looking at the list, and there's some people here that we know are not going to be there next year. So I was under the understanding that they have to reintroduce this bill. So I wanted your thoughts on that, because that's why we were a little bit on the fence of like giving it 100% at this time, because we know that some of these people will not be on the list coming the new year.
Okay, we'll probably get to that in question and answer, because that's a really, really good one. Thanks, Vivian.
You're welcome.
Next up, we have from Illinois, Carrie. You're up. Please unmute.
So I know a lot of you here. I'm Carrie Lelgedal. I have my story is different because I have a 34-year-old son who lives in a long-term care facility. He's been there about 9.5 years, and he will be there the remainder of his life. So for me, this is even a little more passionate because he really could be there another 50 years. I have a meeting tomorrow with Congressman Schwelski, who is a very strong Democrat who has introduced probably more long-term care bills than anybody in the House. This will be my second meeting with her health aide and with the same aide. And I've done a lot of prep for this meeting because I needed to figure out why we got nowhere the first time. Kathy Carlton was with me when I did this call the first time. I had another person with us. So I've spent the last couple of weeks talking to some industry leaders that are on our side. I spoke with Mike Wasserman. I don't even know how many times he's called me. I think as of today, probably 10. I spoke with Penny Cook from the Pioneer Network, and I've spoke with Alex Spanko from Greenhouse Project. And Alex recently worked with the Congresswoman's office on the latest bill that she introduced, trying to change how facilities are built. So they are more they might not all be a true greenhouse, but more in a small facility setting and changing to get away from what we're living in right now. So I kind of want to go over what they explained to me as we are all moving forward, because some of this makes some major sense. And I've also this morning spoke with my regular state representative who could not be a bigger supporter of us if I tried. And I said to him, so what do I do tomorrow with the elephant in the room if they say to me, we won't support this because it was introduced by a very right-wing Republican? And I'm not taking sides here. This is just where we sit. And he said to me, we all need to be using the response of, this is not political. This is a bipartisan bill that is about human rights, quality of life, dignity, and respect. And we need to repetitively say that and get their mind that away from that there is anything political about our bill, because there isn't. One of the other things that was strongly suggested to me by everybody is that we start using phrases along the lines of that we understand when this goes to committee that there will be changes made. We as a group, especially the 12 of us that helped write this bill, we understand that. And if we need to, we will work with them to help make changes. You know, over a year ago when I met with ACA, that was kind of where that broke down. And everyone is stressing that we need, when we're meeting with legislators, we need to bring these things forward. Yes, we have our constituents telling their stories, but
Carrie, not everybody knows all the acronyms. ACA.
Okay, ACA is the American Healthcare Association, which is the biggest industry supporter. They are the industry. They oversee more nursing homes and assisted living than anybody in the country. They have 14,000 members. Sorry, I just lost my train of thought there, Charlie. They also said, you know, let our constituents tell their stories, but we who are coming off as the advocate, because this is what we were doing, we need to limit what we're telling. They've heard the stories 100 times. We need to sell the bill. We need to explain to them there are safety guidelines in there. We need to use current data to support what we're saying. Like I've been able in the last day or two, I have a report that talks about benzos and psychiatric drugs, even just used in the hospitals when there were no visitors or allowed, and the effect of that. And how, if that happened in the hospitals, we know it's going on worse in the facilities. You know, reports and data that show current numbers of residents in facilities, and making sure they understand the facilities are still locking people out. So whoever asked in the chat, am I saying that ACA officially supports the legislation? They publicly said they would support it, but there were things they wanted changed. So we need, you know, when this goes to committee, the committee is they'll work with ACA because that's how it happens. They are the biggest lobby group in the country. And we need to make sure that we are still sitting at the table when that happens, so we don't lose our voices. Because ACA has money, time, and people that we will never have. I think that's everything on my list.
Okay. Good information. Good things to think about going into the next session. Next we have from New Jersey, Kathy Carlton, if you'd like to unmute.
There we go. Hi, can everybody hear me? Wonderful. Yes. So for those of you who don't know me, my name is Kathy Carlton. I'm a nurse practitioner from Northern New Jersey, practicing in long-term care, assisted living, and subacute facilities. I also serve on the leadership team of FACE New Jersey, an advocacy group that was founded by Bill Borelli when he launched that in June of 2021. I don't have a parent in long-term care. My mom lives independently. She's 88, she's driving. She texts messages, plays Scrabble. I'm fortunate, but I've been in the facilities long before COVID, but I've been there day to day with COVID, and I've personally witnessed what families and our residents have gone through. So I'm going to get a little emotional. It's been a major human rights violation for everybody. And I'm very, very passionate about getting HR 3733 passed, and I will get it passed. It's going to take time, but we are passing it. I spoke in Washington, D.C. on June 21st, or June 2021 with Claudia Tenney and Representative Larson on the Capitol steps. It was one of my proudest days as a nurse practitioner. I have been advocating for this bill. In New Jersey, we have 12 members in the House of Representatives, and 4 have co-sponsored the bill. Josh Gottheimer, Mikey Sherrill, Andy Kim, and Jefferson Van Drew. Frank Pallone from New Jersey is the chairman on the Energy and Commerce Committee, and he is not allowed to co-sponsor the bill because it's assigned to his committee. But I did speak with his representative, and he said it's very, very important for us to focus on the 2 committees and to get co-sponsors from the health subcommittees. Bill Pascrell, or Tom Malinowski, I met with him in person. He and his aide are reviewing the bill. And Bill Pascrell, who's another representative, his scheduler is going to set up a meeting with me once a new health legislative aide has been hired. Further in New Jersey, we have Josh Gottheimer, who's a Democrat. He's a co-chair of the Bipartisan Problem Solvers Caucus with Brian Fitzpatrick, who's Republican. Both men are co-sponsors of HR 3733. There are 13 members in this caucus who are either on the Ways and Means Committee or the Energy and Commerce Committees. I am in contact with Josh Gottheimer's health legislative aide, as well as his campaign director, asking them to advocate for HR 3733. They will be setting up meetings for me. Scott Peters is also on this caucus, and he has sponsored HR 3733. We've got 12 more to go. I'm getting them. I also met with Representative Adam Schiff. He's a Democrat. I think most people here know who Adam Schiff is, while he was in New Jersey. I discussed HR 3733 with him, and he, quote, said, "This bill is right up my alley. This is something that I would co-sponsor." He provided me with contact information for his legislative director. I sent her a very robust email about HR 3733, including a chronological timetable and my FAQ documentation. This was forwarded to his health director or his major legislator, and then she forwarded that to the director of health. And she sent me an email this morning saying that she would review the bill, get back to me with any questions. I sent her back an email saying that we were looking for co-sponsorship and that we have several constituents who would like to testify, if they needed to hear further information. In addition to my work with trying to get representatives to sign, I'm also working on endorsements. I am employed by a national insurance company who I cannot mention their name. And I was in their headquarters twice this past year in July and September. I was able to meet with a representative from Governmental Affairs for approximately 30 minutes to review HR 3733 and to ask for company endorsement. They are going to be doing a videotape of me promoting HR 3733, which will be launched nationally. And everybody who signed up on Governmental Affairs as nurse practitioners will be reaching out to me. So it will be another resource. In addition to that, I attended a meeting by AMDA, PALTC, which is the American Medical Directors of America. It's Society of Post-Acute and Long-Term Care Providers. It's a national organization and it's the only organization for medical professionals dealing with post-acute and long-term care populations. I was at a New England chapter meeting this past Saturday in Massachusetts and went with a physician who serves on the National Board of Directors. I reviewed HR 3733 with him, and he is forwarding my information to the head of Governmental Affairs for endorsement in Maryland. PALTC has endorsed several bills in the House and has posted information on Representative Clyburn's COVID-19 subcommittee meeting that some of us attended on September 21st. I submitted a statement, and I know there's several people in this meeting who also submitted statements for this hearing, and they are part of the congressional record. Alice Bonner testified at this hearing. She is a nurse practitioner, and she and I have been exchanging emails. Alice is a director of strategic partnerships for the Center of Innovative Care and Aging, a collaboration between the Johns Hopkins Bloomberg School of Public Health and the Institute for Healthcare Improvement. I'm also working on endorsements from GAPNA, that's the Gerontological Advanced Practice Nurses Association, as well as the HPNA, which is Hospice and Palliative Nursing Association. Both of these are national, organizations. And I would just like to say that if anybody has meetings with representatives or aides, I am very willing to jump on Zoom meetings to offer my perspective as a nurse practitioner who is, well-versed with infectious disease process and learning a lot about civics. So people can reach out to me. I'm always available to do so. Thank you.
Thank you so much, Kathy. That's wonderful. I remember you at the Capitol and to offer your assistance with others as we go into the next session. That's wonderful. Next up, we have Gail Manther from Georgia. If you would like to unmute. Is Gail on the call still? There you are, Gail. See if I can ask you to unmute. Oops.
Now can you hear me?
Yep, there we go.
Okay, good. Hope you can understand my Southern. I'm born and bred right here in this small little town of Hartwell, Georgia. We have about 4,000 residents right now, but people seem to be coming down from Connecticut and over from California. So we're filling up our beautiful lake up here. I approach this from a different side because I don't know anything about what y'all are talking about, not one thing. But I know that my husband died because he was in isolation for so long. And this is what I have written. It tells our story, sort of. I've used it in the newspaper, parts of it. I've used parts of it in different places and intend to follow up with some of the people that we have talked with this letter. I think the more we can get out the 3733 or whatever it's going to be, when, the people don't know what it is, they don't know to ask anybody, and they don't know, they're just oblivious of what goes on in Washington. Me, I didn't know a thing about any of this. So I'm 70 and I'm learning a lot. So I'm going to read this to you, and I'll try to use some expressions so you can understand what I mean. From the beginning, I could not understand why just one person could not go into the nursing home during the pandemic to visit his or her loved one. It just didn't make good common sense to me. With 1 year of nursing home living and all the adjustments we had to make behind us, Tom and I were both somewhat at ease with our situation. However, on March 13th, 2020, Tom began counting days in a little blue notebook, isolation day to a page. We were in a pandemic, they said. Nobody in or out the door who was not essential. The days of separation grew. Day by day, Tom counted. I mourned. We had the prettiest springtime ever, and he wasn't allowed to go outside. The days closed in on 100, and I could hear the pain in his voice when I called. His consistent comment was, I've got to get out of here. That broke my heart. Yes, it did. What did I say to comfort him? To ease his pain, his broken heart? There was nothing I could say. No words. Then I became aware of a Facebook page called Caregivers for Compromise, because isolation kills too. The movement was begun by Mary Shannon Davis from Jacksonville, who sought a job at her husband's facility and was hired as a dishwasher. Then she was able to see him every day. That first group spawned state groups for all 50 states. Now we have 14,000 folks who have stories just like mine, and several states like Texas have gone the extra mile and passed legislation to protect their senior population. I'm certain you will agree not one single person has gone untouched by this virus. No one can begin to list the different ways people were hurt. Aren't we happy now that we are out and about and almost back to normal? But here's my concern. There is nothing to protect those same people from the same kind of isolation should we have another event. The same isolation all over again. However, there is hope. Congresswoman Claudia Tenney introduced the National Essential Caregivers Act to protect long-term care residents and others during public health emergencies. This bipartisan legislation will solve the problems of isolation. In a nutshell, the act called the Essential Caregivers Act, HR 3733, provides for any resident to have up to 2 essential caregivers allowed to visit whenever they wish and stay for up to 12 hours. Many Caregivers for Compromise members have joined the Essential Caregiver Coalition, and this advocacy group produced a book of stories from every state in the union. In this book, real family members share their heartbreaking experiences with their loved ones in long-term care during the pandemic, called Protecting Them to Death: The Impact of Isolation on Long-Term Care. A copy of the book was delivered to the president, the vice president, and every member of Congress this past spring. The cover features snapshots of residents in long-term care from all over the United States. My Tom died on May the 27th, 2022. I believe his life was cut short by at least a year due to the pain and suffering he endured during those months of isolation. He was also very worried about me. And when he brought, when we brought his things home from the facility, I found a note that said, please, please let me come home. I promise I'll be good and I'll help you. Since we both have Parkinson's, coming home for him was impossible. A lady named Irma from Connecticut called me the same day I spoke to the hospice nurse about treating Tom with palliative care only. I told Irma I was going to do everything I could to help her here in Georgia and get this bill passed. And my reason for doing so was to honor Tom for what he had to endure the last years of his life. The elderly and others who reside in skilled nursing facilities all over our country do not deserve this kind of treatment. We desperately need legislation in place so that total isolation cannot and will not happen again. Believe it or not, sooner or later, someone you love, or perhaps you yourself, might be faced with a similar situation. Thank you.
Yeah, thank you, Gail. So sorry for your loss.
Thank you.
Appreciative of your efforts for others in the future. We're gonna get this passed. I loved Kathy's determination. I'm getting that one. Yeah. We're gonna make it happen. And then lastly, we have Liz from Connecticut, if you'd like to update us on some of the stuff you've been working on.
I don't know if there's a thing that I could add. I really don't. Gail, I'm just going to start with you and say, I don't know what you're talking about when you said you don't know what you're doing, because you know exactly what you're doing. You know, I'm listening, and I have very little to add. I really do. And I want to leave time. So I'm going to make this extremely brief. A lot of what Kathy Carlton said I was going to allude to, but what I have been doing, and that was the charge, what have we been doing for 3733? I have worked with multiple groups over the past 2.5 years, and I see all of the work that's being done through the country. And what works for me is to interface with multiple groups and to do it by looking and putting people together. So this forum tonight, I don't think I've been doing anything differently than anybody else is, and I've been doing a lot less than a lot of people who have spoken tonight. But what I am encouraged by is that there are people who have the look of an industry, they have the look of the government, but I know that they are listening. There are key people that I believe that we have turned the heads of. And the one group that encourages me at this point in time is moving forward. I was voicing my frustration to an ombudsman a few months ago. This person said to me, "It's time for you to get irate, Liz." Like I hadn't been for years, and said, "Look up this group." The website for this group is in the chat. I caution you not to be put off by the bland presentation that you're going to see. It looks corporate when you first open it up, but I find this an incredible resource, and I want to help you to just navigate for the people who are continue to work daily. I would ask you to look at their resource hub. I'd like you to look at a place called Policy Dialogues, and I'll put this out for people who are interested. There are 4 videos. If you open up the first one, it's called The Quality of Care in Nursing Home. Don't you have to look at that? We know what's going on. It has an extremely dry opening. And then you get into minute 11. And it starts to explode with Dr. Grabowski, who spoke in Congress. I want to tell you, and I'm putting my notes aside, that because of the work that's being done across the country, when I was asked to go to Washington to be the family rep and I couldn't go, and it just was much too short a notice. They said, you can do something virtual, you can get letters out. And so I sat down in a moment and just sent out 50 emails. And those 50 emails produced half of the letters, or about half of the letters that are in the congressional record right now. Networking couldn't be more important than at this point in time as we transition from this session into the next session. And I know there are questions about what happens in the next session. And in the chat, there is a link to what happens to a bill and what happens when a bill dies and how is it regenerated in the next session. And we can talk about that. I have more notes here. And to be honest with you, I don't even feel like reading them because I think people have covered so much. I just want to end with, there are people waiting for us to access them. I want to talk about someone who's in the chat called Lori LeBay. Lori LeBay runs something called Alzheimer's Speaks. On 2 different occasions, she has made gestures to come on the radio show, and she's extremely organized. And a year ago, she made that gesture. She made the overture again this summer. And I believe that at the beginning of the next session, when we get organized, it's the time to strike that iron and go on with Lori LeBay. I could go on and on. I'm going to stop because I believe it would be a travesty if we didn't answer some questions. And I'm looking at the clock. I just thank everybody for joining us. To think that we have this many people here tonight is beyond encouraging.
Thank you, Liz. One of the things that we had on the agenda was anticipated actions post-election. I just wanted to quickly say that I attended a lobby conference, some people might know, up in Hartford, Connecticut. And I walked away with two things. One was it's all about relationship building. And many of you have met with your legislative aides, and that work will continue into the next legislative session as there might be new aides. The second thing is it validated everything that we've been doing with what Irma's been doing, contacting all these different offices. It's about, you have to focus, you have to view it as educating the legislators. So they don't know the minutia that we know because we're in it. They're supposed to know like about all of these things when you think about, you know, when we elect our officials. So every little detail that you think they might know, they don't know. And we have to continue that along those paths of seeing our role as educator. Carrie, can unmute?
So I just realized I probably forgot the most important thing that was told to me. When the legislators, even if it's before they say to us, but CMS has said facilities are open, they are not to restrict visitation, da, 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 da. We need to make sure that our legislators know that CMS is not holding the state survey agencies accountable. That whether we file a complaint with the state or we have been to CMS, that they are not doing their job. CMS is accountable to Congress. And if we do not voice how little they do, how they won't respond, how they won't work with us, and when we have, you know, for months they said to people, oh, well, if your survey agency is not doing their job, contact your regional CMS office and we will step in. That is not happening. You know, if you have reached out to Dr. Flesher, or you have reached out to Evan Schulman and they have not responded or done something, make sure you're telling your legislators this. We have to show them what CMS is not doing in hopes of also the process of this, of getting CMS overhauled.
Thank you.
Can you go to the chat, Amy, and answer? Are there questions in the chat?
Yeah, no, there really aren't. I mean, Marcia Smith wanted to make some comments about her Congressman Kleinberg. If you can make brief comments, you can unmute.
Good evening, everyone. This is Macy Smith. I'm here in South Carolina. That's okay. I get called Marcy all the time. Thank you all so much for the amazing work that you've been doing. I'm here in South Carolina, like I stated. I'm a licensed social worker and a gerontologist. And so while I am in support of the national bill, I am working on a state bill because, as you all know, the national bill does not cover assisted livings where many of our individuals with dementia live in the dementia care part. But I did want to make mention of my meeting with Congressman Clyburn. I'm very close with the family, and I had the opportunity to have some FaceTime with him several times within the past couple of weeks. And because he's the majority whip, he will not sign off on a bill until it comes out of committee. And so he has the bill, he's well aware of the bill, and he'll be prepared to vote once it comes out of committee. So I wanted to let you all know that. Because I know there's been some push for him to sign off on the bill, and he does not sign off on bills as the majority whip.
So
that is so helpful to have that information. I think all of us are learning civics 101, 102.
Yes.
Us around 400. So thank you very, very much for that. And
thank you, Macy.
If you ever meet with him again, just major respect for him.
Yeah,
I will, and I'll tell y'all this. But his daughter is actually the recipient of the first ever Dare to Lead award that's awarded by Lisa Gibbons. I'm sure everybody on the line knows Lisa Gibbons. So I'm on her advisory board, and we all met, and she'll be the recipient of that award next week. So I will remind him of HR 3733, just to keep it at top of mind, that's all. But I assure I think we're in good standings with that.
Thank you, Macy. Thank you.
Thank you for joining us. Did Melody have a question? Melody?
Yeah, actually, I had a comment because as I've been, and thank you everyone for your stories and your input and feedback. And as I'm listening to the different pieces of information, I'm hearing a lot of commonalities, not just in our intent, but in the contacts, in the support in which legislators are being contacted. And I'm wondering if we can do either start something new, or a long time ago with the different groups that are involved in Essential Caregivers movement, there was a spreadsheet that was begun. It may have said someone's name, the state they're in, who they've been contacting. I'm kind of just throwing it out as a brainstorming in an effort to say what may we be able to do that's more that's a stronger voice and a concerted effort. For example, my ears perked when it was mentioned someone had reached out to Nancy Pelosi's office, and here in California, I know Irma's help. Plus, we have some team members here in California who are constituents who have been very heavy into getting in contact with Nancy Pelosi's office. So someone in Nancy Pelosi's office might say, oh, there's the people from California, there's the people from there, and there's the people from here. But if you have all of us coming together, and that's just one example, and I heard many other examples of perhaps industry or other type of networking support, or legislators that, and perhaps this is a good meeting to start the conversation on how we can maybe bring those forces together as a voice, rather than just being heard as some of these pieces, pieces here and there. Just throwing it out more for brainstorming on how to do that. Thoughts?
Quick, I think we have one more question, and we have, or one or two more questions, but I want, if Amy didn't cover this, I want to say that this recording will be available to everybody. So, I mean, nobody owns this. We all own it. If you're here, you get, and I think there was some chat about possibly cleaning it up so that we could use it, anybody could use it however they want to. Okay.
Yes. Thank you for that. Yes, I did forget that. It will be available. Please, everyone, remember to save the chat, those buttons on the right in your chat. And Karen, you had a question. You want to unmute?
Yeah, I did. And I sent it to Liz. I guess I should have sent it to everyone. So last time when you guys were speaking to me, you talked about having meetings with this health assistants from Larson's office and Ways and Means, and that you were trying to meet with the staff, and also Energy and Commerce, because the Ways and Means staff committee had asked you to get certain things from Mike Dunn at Larson's office, like CBO score, CMS analysis, and something else, and then nothing happened, and we didn't hear anything, and so I asked. My question was about those things. Did we get that information? Why didn't we? And why haven't we heard anything from those offices about why we only have like 10 days left in the session and they haven't done anything, gone any further with CMS markup, with the markup, or is it going to get out of committee, or any of those things? Do you have any information on any of that?
I'm going to jump. I don't know if I'm the best person to answer this, but I think and Irma, you can jump in, please. I don't see where you are now, but I have a collage in front of me. We don't have the answer. I don't have the answers to those questions. And you're right. There were meetings with Energy and Commerce and with Ways and Means. There were tidbits, but they were, and again, I call on Irma to please, if you can wrap this up in a minute or two. you know, I was disappointed for one. I'll be very honest with people with those committee meetings, but I know Irma pulled some nuggets out. And in terms of the questions to Mike Dunn, who's the health assistant for Representative Larson, no, we did not get answers. So that's the simple answer to that. Why? So, we can't answer why, but Irma, can you, what were the pullaways from?
I'd like to just go to Janine now because it's 9 o'clock.
Okay.
That's what my opinion is. I'd like to go to Janine and have her ask her question because she actually had been asking before Karen Klink.
Okay.
Thank you.
Oh, thank you. Just briefly, I've seen Irma in action and she is my Shiro. She is like a velvet glove. She joined me for a Zoom with Grace Meng, my representative here in Forest Hills, and gave a very compelling reason to join and it's co-sponsoring this bill. And I've picked up from her examples, and I'm doing the same with everyone that has 2 ears and will listen to me. I'm very, very passionate about this. I formed a family council in my father's nursing home in Montrose, New York. It's a VA accredited nursing home, but it's run by the New York State Department of Health, which means that my dad is screwed. There's no accountability. It's terrible. But I did have the good sense to invite Irma onto my family council Zoom, and she spoke to a number of our family council members and got them to join her on Zooms with their legislators. So she's amazing. I cannot say enough about Irma, and I'm just introducing myself. I'm the family council liaison for the LTCCC. Richard Mollett has graciously lent us his Zoom room for the last 3 years. And he hired me recently as the family council liaison to help build family councils throughout the country. Well, first in New York, but I'm going to go for the country. So if you have a family council, if you need some help or mentorship with family councils, I grew mine from 15 to 126, and I would love to help you.
So
That's
Janine, explain to people what LTT, what
I got to take a breath. The LTCCC is the Long-Term Care and Community Coalition. They've been around for about 30 years. They're based in New York, but they're countrywide. I'll put the website in the chat, and they are a incredible resource. It's a nonprofit advocacy group for nursing home residents, long-term care residents, and their families. It's run by Richard Mollett, who is a doll. And he's very, very learned about all things nursing home and long-term care facilities. I cannot say enough about him. I'll put the website in the chat. Please check it out because the resources you would not believe. They have tons of webinars and they have free resources you can download and do what you will.
Janine,
Thank you.
Janine, would you put your contact information in the chat as well?
You bet your bippy I will. Thank you, Bill Lamb. Thank you, everyone.
Okay, so I guess the last wrap up is, and it seems from the chats that people like this. So we would like to do sort of like a forum in the future. That's what I'm getting from this. We will try to make the emails blind. I had some people ask for that. I apologize. I did not know how to do that. So I apologize up front. I think everyone was pretty good about that. Thanks for adding information. Remember, save the chat so you can save all of that. And Liz, I don't know if you have any last comments, but maybe in a month, maybe in the next one, well, certainly after the election, maybe sometime in December, we start to think about those next steps for the next session. Yes, that sounds good. Okay. Well, thank you, everybody. Thank you. Thank you. At all levels. And somebody did mention about some of the acronyms. We'll try to do better on that.
Some random guy.
Please email me specifically if there were still some outstanding questions. Everyone should have my email and Liz's. Awesome. Thank you.
Thank you.
Bye.
Bye. Thank you.
Thank you. We'll get this tomorrow, Terry. Don't worry. We'll be good.
Thanks,
everybody. I saved my chat.
That was awesome.
Thank you so much.
Thank you. Good job.
Yeah, we'll get the recording going too.
Thanks, everyone.
Thank you.
Bye.
Thank you.
Thank you.
I'm wondering, do we have any residents that are here or that were here?
Nancy, she was in the chat.
Hi.
Nancy.
Nancy's
so
still here.
If you save the chat.
Okay. How do I save the chat? I'm working
It's
on
the dots to the right of the emoji in the chat. Do you see the 3 dots?
Got it. Mm-hmm.
Click that and then you should say save chat. You see
I just have chat, meeting settings, backgrounds and effects, and disconnect audio.
No, in the chat where you would type in the chat.
Are you on an iPad, Nancy?
I am.
Oh,
it's completely different.
Sorry.
Okay. Sorry about that.
But Nancy, if you put your email in the chat, we can email it to you. I'd be happy to email you.
Oh, thanks for taking the time to do that, Janine.
Absolutely.
Thanks.
Where can I ask you where I would add that? I don't see that either on mine. I
And
think
then
she's on iPad.
Smiley face.
I'm trying to find it. I have chat 82 meeting settings, background and effects, disconnect audio.
And that has an iPad also.
Yes.
Yeah. So
you
Annette,
gotta
what's your email? I'll email you.
Okay, you'll email me because I don't
I'll
see
email
here where
you
I
and
can.
Nancy.
Unfortunately.
In the chat.
Amy, Liz is trying to get in, she said.
Oh, okay. Waiting room. Thank you.
And Irma,
just put your email, Annette, put your email in the chat.
I don't see where I can insert an email address anywhere.
Annette, if you call it out to me, if you can speak it to me, I'm writing it down.
I have her email, so
I was gonna say I'll send it.
Okay, great. Thank you so much.
Wait, I'll put it in the chat is what I meant. Hold on.
And also everyone's emails are in that first email, right? That you sent. They're all there. But
yes, that was my.
Well, I don't see anything wrong with that anyway, Amy, because
I love that you did that. That was great.
I don't mind it at all. Just one person complained that you can't make everybody happy.
That's true. You're right. As 125, only one person. So that was correct.
Amy, I think it's great because it made me feel like there are lots of people signed on to this.
Right.
It made me feel like I was part of a group.
Right. So, that's how I felt in the Connecticut group when we had about 19 or 20. I liked seeing all the names.
And as I was mentioning, it was really nice too to see, across the country and not only more people involved, but this is knowing where we can find some common strengths.
Good.
To bring together as a bigger voice, I think.
The whole thing is that we have like 4 men here.
Yeah.
Now we just need to get them all to speak.
They were all at the Transformation Tuesday meeting today.
Yes.
Yeah, there was a lot
at work,
of men there.
and I could not see.
Live Oak has a lot.
It's okay. It's the women, Carrie. It's the women.
No, I know. And actually, and I guess I should have thought of this when we started this, was oh God, the guy from Gray Panthers, was he invited to this?
No.
I invited.
He's an industry person.
No way.
No, he's Gray Panthers is all.
Yeah, you mean Jack Kupferman?
Thank you, Jack.
That's how you're thinking of?
I invited one of the ladies from the East Bay Berkeley group.
Yeah, you know what, Carrie, this is, I think there was a fine line because if you do Jack, why wouldn't I have done Alice? Alice wanted to come and what's the difference really? So, and I know some people would say, well, because, leading age is funding, but I think that I would rather have aired on this side that we did this time.
You're correct.
Yeah.
You are okay.
Line. Yeah.
I'm okay with that once you go that route.
Yeah.
Okay, I need to go call my sister-in-law to get ready for tomorrow night.
Bye.
Everybody cross your fingers that I get somewhere.
You got a meeting with Schakowsky's office.
Tomorrow afternoon. Let's see how this goes.
Woot woot. I know you've been looking at that a long time. Nice.
Yeah, this is meeting number 2, so let's see.
Good.
Okay.
Irma, I did get a call. Irma, I got a call back from Erin Doty. But I was getting a biopsy today, so I'll give her a call tomorrow.
Erin Doty is the health assistant for Raul Ruiz in California, who are trying to get co-sponsor. Okay.
Yeah, and, we just had Irma and I just had a meeting with another lovely lady named Janice. But she and I are gonna do a one-on-one talk tomorrow about this.
Okay, very good. Thank you.
Awesome. Thanks for coming.
Nice to meet you.
Nice to meet you.
Thank you. Thank you, everybody, for putting your heart and soul into all
you
this
get some
work.
rest, Nancy, tonight, all right?
I will. Good night. Take good care. It's nice to see everyone.
Cough once.
Yeah, Kathy, you didn't cough once.
And where'd Deb go? Did she sign off? Oh, shit.
Yes, after she asked you what you were eating and you didn't answer her.
I wanted her to talk.
She said something to me, Deb?
Yeah, in the chat.
Oh, what'd she say?
Gail?
What she and Liz?
Oh, Marilyn. Hi, sweetheart.
How are you feeling, Kathy? Thanks for coming.
At the meeting.
I'm hanging in there. I literally